Before Dr. C. Everett Koop became a household name as the 13th Surgeon General of the United States, he was already a force in the medical world, a trailblazer in pediatric surgery, a man shaped by deep moral convictions, and someone whose very presence challenged political and social norms. But despite his iconic public image, bow tie, beard, and all, his story has often been flattened, simplified, or forgotten altogether. From PHI Media, I'm Gordon Thane. And joining me for a conversation is someone who knew Dr. Koop personally and decided to bring his full complexity to light. His new biography is the first comprehensive account of Dr. Koop's life and legacy, capturing the contradictions, convictions, and courage of a man who reshaped public health from the inside out. This is my conversation with Dr. Nigel S. Cameron. You're listening to the Public Health Insight Podcast, your go-to space for all things public health and global health, from the Sustainable Development Goals to the social determinants of health, as well as interesting dialogues about the diverse career opportunities that exist in these fields. Remember to subscribe to the podcast and leave us a rating on Apple Podcasts and Spotify so other people like you can benefit from our content. Nigel, welcome to the Public Health Insight Podcast.
Great to be here.
Awesome. So I was very excited. I was speaking to you off air about how in the public health space, I'm always looking for inspirations, looking back in history to see what key figures in the public health space accomplished. And I'm a big quirky person when it comes to quotes. And so the first time I came across Dr. Koop was looking for different public health inspirational quotes. And that brought me into his world a bit. And that's sort of where it stayed for a long time, very surface level understanding of Dr. Koop, until I got the reach out from your team about this book that you will be releasing very soon, I think in a week from now as we record this. Mm-hmm. And it's about Dr. C. Everett Koop, who was the 13th Surgeon General for the United States. And so we're going to dive into that. I think there's some fascinating stories about him, some of his beliefs and views in the public health space. I found that when I was reading about him, it was hard to put him in a specific box. At any time I thought I had him pinned down, well, this doesn't make sense. So he was a very difficult person for me in the way I categorize things in my head to put him in a box. And that makes him a fascinating character. But before we get into that, I think you're a fascinating person as well, having been your background in bioethics, a historian, a lot of knowledge in terms of emerging technologies. And so I wanted to talk to you first about the author of the book, but who are you? That's a very important question for us to explore. So talk to us about some of the previous works that you've been involved with. This is not your first book. Talk to us about some of the other works that you've been involved with as an author or even in your professional life as well.
Sure. Well, thank you. It's very good to be here. Do something like writing a biography. It takes a long time, and you have to argue your way into it with publishers and editors and so on, and you have to present yourself. And so I've been doing a fair amount of thinking about what have I done before? How do I get to be doing this? And in fact, the last book I wrote was almost 10 years ago, and it was a book with a very simple title, Will Robots Take Your Job? And of course, right. I don't know whether robots will take the job of biographers or podcasters. But it's a lot edgier now than it would have been 10 years ago, as these technologies come to supplant what humans have been doing. And I suppose if you were to put together my efforts over the years, that's really where they come. What is the human question? How can technology help us to be more human, more fully human, aid us as humans, rather than getting in the way? And so to that end, I've run projects on the impacts, social impacts of technology. I was at the Illinois Institute of Technology for some years, project on nanotechnology, on biotechnology, project also on diabetes, interesting the sort of interface of medicine and science and policy. And these things have interested me. I began in philosophy and religion. I got into ethics. Bioethics was a hot thing back when I was 50 years younger. And so these things have all intertwined as I've had various academic appointments. I run a little think tank in Washington, D.C., looking at the policy impacts of emerging technologies. But I always come back to the human question. And one reason why I find Koop so interesting is that he was very much a human being. And like all humans, he had feet of clay, and we discussed this in the book. He had his foibles, he had things he liked, things he didn't like. He was quite a character, a very human being. And that's one reason why I liked him personally, and why I think he's a very interesting subject to be writing about, and why I think he's someone we can learn a lot about as we are trying to learn things now, and to be better humans, and to create a society better for humans.
That's fascinating. Can you tell me a little bit about how your experience following Dr. Koop? Was he someone that in real time was in your consciousness and you followed him over time, or was he someone as he became less active in the medical and public health and political space that you started to learn and understand more about him? Can you help me situate me with that?
It's an interesting, rather curious experience. So back in the 1980s, I was in Edinburgh in Scotland, which was my hometown. And I was running a project on ethics, religion, bioethics, these sort of issues. And we would have people come and give lectures. And this, of course, is when he was Surgeon General and when he was starting to become pretty famous in the mid-'80s. And I just heard of him. And so I wrote to him. Back in those days, this is, of course, before email, pretty much before the fax, you would sit and you would produce this very, very skinny paper. And they would sell these airmail letters, which were very light. And you had a fairly limited scope. You only had room for maybe 300 words. So I would get one of these, and I thought, well, it'll take me half an hour to write to the great Dr. Koop. Stick it in the mail. Can you come over and give us some lectures? One of the things about inviting government people to do things is, in most contexts, you can't pay them. So that's a plus. So anyway, I just sent it off, and who knows. So I got a phone call. I can still remember, hey, this is Chick Koop.
So he directly...
He called me. He worked out the time. So he called me, hey, this is Chick Koop. And my assistant or whatever said, and we had this conversation. And he said, oh, I love England. Well, of course, I was in Scotland, close. And he said, there are things I can say more easily outside the country. And the other thing he said is, this government owes me a lot of vacation time. And in fact, it was more than a year before he actually came over at my invitation. It was in October, November of 86. I'd written to him in spring of 85. In fact, one of the fun things about researching his papers is discovering my correspondence with him from the 1980s, which is all in the National Library of Medicine.
Right. Oh, my goodness.
Because I didn't keep copies of over these years. It's all there. He came over and spent maybe just over a week, maybe 8 days in the UK. And I set up a couple of conferences, one in Edinburgh, where I was living, one in London, and arranged for him to give lectures in several medical schools, and traveled around with him for just over a week. He had dinner one night in our home in Edinburgh, which was a lot of fun. Because, of course, he was a pediatric surgeon, so he was good with kids.
Right.
And at that point, we had 5 little kids. And we had 4 little kids. And the eldest, Anastasia and Lydia, were then, I think they were 7 and 5. Of course, you can work out how old they are now. And so they had their own families and all that. But they were 7 and 5. And Koop he liked to have fun. And he was running a campaign, which I talk a lot about in the book, at the time, against cigarette smoking, against tobacco. And he had a thing called Smoke-Free Society 2000. He was aiming to get rid of tobacco altogether by 2000. And he had these little pins. American term, pins. In Scotland, we call them badges or something. And he stood up after dinner. And my little girls, he said, Anastasia, Lydia, come here. And mock formality. He said, I am going to present each of you with one of these Smoke-Free Society pins. And he said, you are the only recipients in the United Kingdom outside the U.S. Embassy. And he shook their hands. They have not forgotten this. And he handed them the pins, which, of course, they have lost. And then, anyway, so we had this trip, and he was very friendly. And it was a bit difficult sometimes. I mean, he had to go and he wouldn't stay with people's homes. He would stay in hotels because he had to spend hours on the phone and all like that. And so after his visit, I sent him a thank you letter with a check for his expenses, as you do. And he wrote back, and with a check for $100, which was worth a lot more back then than it is now.
Right, right.
And he said, Betty, his wife, Betty and I want to take you guys out for pizza.
Wow.
And we became friends. And then we moved to the States in 1991. Several years later, I got a job teaching. We reconnected, and he got me onto a nonprofit board he was on, and so we'd meet 2 or 3 times a year. He was helpful and encouraging, and so on. So we had a friendship. And then I was invited, and this is the book begins, in fact, by discussing this, his 90th birthday party, which was co-hosted by Hillary Clinton, as well as a Republican senator. And so I was invited to the 90th birthday party. And I did actually meet him once or twice after that, but we were friends. And it was never, he had a gift for friendship. And he would make friends of younger men. Guys who were maybe around the same age as his kids. He had 3 boys and a girl. One of the sons was killed, but that's some sort of generation down. And he would maintain these friendships over time. Of course, when he was a surgeon, he'd had many students, residents working with him, that one generation down. And I think that was something he liked to do. And so I was a beneficiary of this very broad circle of friendship. One little funny story. His nickname was Chick. And there's a whole story behind that, which we may get into, which is in the book. Buy the book when you get the story. And so when we first met up, I picked him up at the airport or something, came back to our office, and staff of colleagues was there. And he said to me, hey, you can call me Chick. And then he said, but it's not that special, but she can call me Chick too. He had this love of informality.
Right.
And for somebody who was quite so important and could be quite difficult because he realized he was important, he also had this fun side to him, which we experienced right from the start.
You kind of mentioned around one of your last visits at his 90th birthday party. When did that idea of, I need to be the one to write this book, when did you start to get those thoughts?
Well, yes, it's a curious thing, isn't it, how you get into things. We were friendly. I last saw him, but he passed in 2013. He got married again in 2010. It was before this, so maybe 2009. I had a chance to meet him for lunch, and so we got together. That was the last time we actually met. And he passed. I didn't go to his funeral or to the big public service. I forget if I knew about them or why. But in just before COVID, so this is what, 2000, he came into my head. People pass, you don't think about them all the time. Something reminds you of somebody whom you used to think about a lot more.
Right.
And so I just thought, well, maybe someone's written a biography. So it's all easy now. Go on Google, find out.
Right.
And I was quite surprised to find that after his passing in 2013, there's hardly anything written about him.
Wow.
I was very surprised to find that nothing. Now, there were the obituaries when he passed were extensive. Of course, these things get written many years beforehand and so on. Long stories. He was 96. And a huge outpouring of stuff back when he passed 2013. And after that, literally almost nothing at all online. You can go search. Nothing for years and years and years. And so I thought, well, maybe somebody is writing a biography. I wasn't at this point thinking, I'm going to write a biography.
Yes,
I was just intrigued.
Right. You would have
And then
probably read it.
I would have been a customer. And then I thought, maybe it's something I could do because I write and I'm kind of semi-retired and so on and so forth. And I thought, people can write for years. People can write biographies for years. And underground, it's like being down in a coal mine. You're just working your way at this thing. And how would I best find out if anybody was writing a biography?
Right.
And I thought the best person to contact is Tony Fauci. Now, Tony Fauci then was famous. He, of course, became uber famous through his role in the COVID situation. But this was just before COVID. Now, I had met Dr. Fauci before 2 or 3 times, going back 20 years. I'm sure he wouldn't have remembered. And we discussed Koop, and I discovered that he was a friend of mine, and that he, in fact, was a friend of Koop. He and Koop became quite close. This wasn't a big public thing, but they were really close. And we discovered this at these earlier occasions when we met at conferences. Anyway, so I thought, Fauci. Now, Fauci's total workaholic, and he only retired a couple of years ago, but he's now got another job. But he was still doing his own email. This was before COVID. 6 months later, it would have been very difficult to get to him
No
at all.
chance.
But he just responded immediately, and he said, "No, I don't think anybody is. No one's talked to me about it. Yes, I'm happy to have a chat." So in fact, I had 3 different interviews with Dr. Fauci. It was really very helpful, and talking about their friendship and talking about how they really first got to know each other. I thought Fauci would know. Anybody trying to write a biography of Koop would be after Fauci.
Go through Dr. Fauci.
And the fact Fauci was very accessible. I thought this is really, very interesting. I then began talking to 1 or 2 other people about writing biographies, including 1 or 2 people who write biographies, and 1 or 2 historian friend of mine who was a retired professor of pediatrics. People who knew the field and knew things about Koop. And then I thought, maybe this is what I'm being called to do. And partly, I suppose, a kind of labor of love. I mean, it's a labor of respect, shall we say, because I think he was a fascinating individual. But more than that, I think there's a lot to be learned from him. I was surprised how difficult I found it to get a publisher. I thought I'd get a commercial publisher and then advance. I wouldn't make a lot of money out of it, but I thought one of the big 5 in New York, battering away, trying to get agents to take it. Various interesting conversations. People have all forgotten him.
Why do you think, can you share, why do you think that was?
Well, I think how does I would say this? He lived too long. It was a bad career move. He faded slowly. I think if he had passed away in office or passed away 10 years later, in the 90s, in the 2000s, I think much more likely somebody would have written a book about it. But he faded. And I think also he was complicated. I mean, whether you're talking about abortion or AIDS or what, it is a hugely controversial issue. And he had strong views on them. And anybody who would agree with him about everything.
Exactly.
And we like our heroes simple. I've been an American for a long time. I lived in the States almost 30 years. But I think Americans particularly like their heroes simple. And he wasn't that kind of hero.
Not at all.
And everybody would say, "Oh, he was so wonderful, but." And they would then want to have some footnotes. And that is not an easy person to get everyone excited about. I was quite surprised about the generational list. One press that I went to, very well-known, major publisher. And the editor I spoke to actually was a hero. She was a fan, and I had met with Koop because he wrote an introduction to a book they were working on. She was an older lady. She said, "Well, we have a brown bag lunch once a week to have our first look at new projects. So I'll take this along, and I'll see what the guys make of it. And this will be the marketing people, the editorial people, and so on." And she emailed me and said, "I'm not totally surprised, but I have to tell you, marketing, promotional types are all young people." And they said, "I've never heard of this guy. And why would we bother?" And I then had another round with another major academic publisher. Very interested, read all my staff proposal, sample chapters, and so on. Got them all reviewed by academics working in the field. This is what academic presses do. They were absolutely enthusiastic about the book. So the process took 3 or 4 months. And the guy writes to me, the key editor, and he says, "We've got a meeting on, it was Wednesday, and I'm looking forward to writing you some good news on Wednesday night." I did not hear from him. On Thursday, I get this excruciating email, which he says, "We spent almost all of our meeting yesterday talking about your book, and I lost the argument." He said, basically because these younger people had not heard of him.
Wow, that's a common theme.
Now, I then took that to University of Massachusetts Press, who published and who have been absolute joy to work with. And their response, first of all, was, "Why wouldn't you publish a biography of somebody people haven't heard of?" I mean, people do that all the time.
Well, it was one of the points of doing it.
But as it happened, I had these wonderful reviews from the anonymous academic reviewers that I could immediately just pass on to the University of Massachusetts Press. So they already had a lot to go on. And they said, "Yes, we'll do the book." But it was interesting to me, and I think there's a lesson that the people who get biographies written about them aren't necessarily the ones who are most deserving of it. Now, I mean, I've spent quite a lot of time now mixing with other biographers, which I think is a very interesting group of people. And of course, there's a lot of focus now on biographies of people, women, minorities, and so on, who've been underserved in the biography community, which is really important stuff.
Right.
But because they weren't white guys, they didn't get written about. And this also became a problem for me in trying to find a publisher, because he's a white guy.
Right.
So I went through, it surprised me, it took me a couple of years to settle down and find a publisher. And of course, I was working on the book all the time. And I think there's so much to be learned from Koop, not least, of course, in the utterly bizarre political environment in which Washington finds itself now.
Right.
Because he was a man of principle, and he would make friends left, right, and center. And he believed in science, and he wanted to get stuff done.
Right.
And this is not all that typical these days.
Coming up next is the second chapter of this 3-part miniseries, where we explore Dr. Koop's early life and formative experiences before he became the 13th Surgeon General of the United States, including how he championed the acceptance of pediatric medicine as a recognized specialty and began to question the limits of one-on-one care. That's next time on the Public Health Insight Podcast. This show was edited by me, Gordon Thane, with additional editing from LaShawn Benedict. Sound design and mixing by myself and LaShawn Benedict. The original music from The Music Room, composed by Tom Fox, licensed from Johnny Harris. The cover art designed for our show by LaShawn Benedict. The Public Health Insight Podcast is produced by PHI Media. Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our podcast, be sure to subscribe and leave us a rating on Apple Podcasts or Spotify. See you in the next one.